Hello, my name is Shalai McMillan, and I'll be discussing the nurse staffing crisis. There's an increase in the number of aging patients, more nurses retiring, and an increase in patients with a higher acuity. It is harder to become a nurse due to a shortage in educators, clinical sites, and preceptors to accommodate these students. According to the American Association of College of Nurses reports from the baccalaureate and graduate programs, U.S. schools had to turn away 65,766 qualified applicants due to this factor. Hospitals will also try to cut staffing when they need to cut costs. Due to the stresses of the job, especially since the COVID-19 pandemic, this creates a higher turnover rate. With the mix of long shifts, pressures from families and patients, heavy workloads, insufficient staffing, and many simultaneous tasks, a nurse can easily become overwhelmed. Burnout is when the nurse ignores this and enters a state of emotional and physical exhaustion, especially with the many tasks to be completed, meetings to attend, and managers to please. There isn't much room to build that relationship with the patient and do the small things that can be more therapeutic for the patient's experience. This can leave the nurse feeling like they can't give an adequate care that they want to, and it can take a mental toll. They will either leave their job or continue with a lower standard of care. To have better retention to help with the nursing shortage, nurses want respect from other staff members and patients, effective communication from team leaders, and proper recognition. Pizza parties will not cut it anymore. They also want competitive pay and good benefits. Nurses may choose to start a nurse-led committee that speaks to leaders and higher-ups in their hospitals about their grievances. Some nurses have opted to unionize. Nursing unions help negotiate better pay and raises, better healthcare benefits, and leave more options and retirement plans. The union can also negotiate tuition reimbursement and overtime pay. To retain more new graduates, nursing staff should implement a proper nurse residency program, or NRP. This allows new nurses to receive orientation with set objectives and goals. The NRP includes frequent meetings with the nurse manager and residency staff to check on their progress and well-being. This gives an opportunity to discuss any concerns and to give feedback. The NRP could also provide education on the specific patient population that the new graduate will work with. This can make the job less overwhelming when it's easier to relate and care for that population. Burnout occurs when we're constantly overwhelmed and exhausted. With proper staffing ratios and taking periods of rest, this can help lessen the progression of burnout. By reaching out to policymakers, a law can be created that creates strict nurse-to-patient ratios. This law, currently only active in California, requires hospitals to maintain a minimum nurse-to-patient ratio based on each unit. This allows safe patient ratios at every hospital, rather than a 1:6 ratio on one med-surg unit and then a 1:8 on another. Minimum nurse-to-patient ratios improve mortality rates, decrease readmissions, and decrease a patient's length of stay. It can also decrease the workload of the nurse and improve their physical and mental health. Taking adequate rest breaks can decrease burnout. Having an uninterrupted break can allow the nurse to have a psychological detachment from the workload. This can also decrease fatigue as the nurse is able to take a physical break as well. Nurses should reach out to their leadership team about employing a resource or break nurse. This nurse can make sure to take over patient care so that the primary nurse can take their break. At my organization, we have a buddy system where another nurse will cover for the other while they're on break. But a lot of the time, the system doesn't work because the nurse who isn't on break will have a higher patient load, and the nurse on break will have to leave in order to help.